benefits of dry needling are primarily pain relief that occurs because of the relaxation or the fixing, if you will, of that trigger point, because trigger points can be an immense source of pain. So next, Vilma's going to help me demonstrate dry needling with electrical stimulation, which is a variation of the dry needling. It can be very helpful with chronic low back pain. So you find the level which the patient has the low back pain. So for her, it's around here. I know this because, as we assume, we determine with the examination, right? So before dry needling and before you become a dry needling patient, a thorough examination is performed to figure out if dry needling is the right treatment for you, and if so, what type and where. Was evaluation, we determined she has chronic low back pain at this level, so we're going to go ahead and get started. And we decided that we're going to do dry needling with electrical stimulation since her pain is chronic. Now we're targeting the deep, deep lumbar muscles here. So Vilma, what you're gonna feel is a thumping sensation, like a tap, okay? And that's how you know that the muscles are contracting, and you gotta let me know, all right? Because sometimes I can't see it. So we're gonna go ahead and start to turn up very slowly to the patient's tolerance. Do you feel like a tapping sensation deep in your muscles?
Yes.
So that's a positive response. So now we just go to patient tolerance. So can you take a little bit more?
Yeah.
Okay, tell me when to stop.
Okay, you can stop.
Okay. Can you hold that for 5 minutes?
Yeah.
Okay, so now we wait the 5 minutes and let the needles do their work. Wait a minute, can't see it. So yeah, on the actual treatment, it doesn't matter if you can feel it or not, right? It doesn't matter if you can see it or not. We have Vilma here, another demonstration patient. Let's say we did the exam again, and she has upper trap pain. So we're gonna go ahead and wipe it down per usual. Vilma, can you point to where you usually have your pain? Kind of in that area. So I'm gonna go ahead and palpate again, trying to find the trigger point. And I can feel one right there. So for the upper traps, right there, correct?
Yep.
Insert the needle at an angle to avoid the lung field. And go down. And then you piston up and down. Now again, we're not getting a twitch response from Vilma here because she doesn't actually have any dysfunction here. She's just being a good soldier. Up and down, and pull the needle out. And that's it. Dry needling is very similar to acupuncture in the terms that it uses the same type of needles. That's kind of where the similarities end. Dry needling is a very focused treatment for relieving trigger points, which again can be a source of pain. It's kind of in 3 parts. It's muscular in the sense that it actually relieves that trigger point we've been talking about. It's chemical in the sense that there's usually an increased inflammatory response where the taut band of tissue is, where the knot is, and it helps kind of rebalance that chemistry. And there's also neurological adaptations that occur when you do dry needling. On that note, dry needling is actually really good for stroke patients as well that experience spasticity. There's evidence that shows that dry needling can reduce spasticity in those patients prior to doing things like, say, stretching to make it easier to stretch out that spastic tissue.